All right, so this is week 5. Heart and lungs. We got a lot to get through this week in anatomy, but it's going to be fun. And these two body systems, though they're two pretty decent-sized body systems, they relate in so many ways, right? So it makes sense to kind of do them together. But what we're going to start with is, of course, the heart and all the board stuff related to our first day of cardiac lecture. So starting off with just some basic terminology, we have our mediastinum. Did any of you guys come across what this might be? Okay, good guess, good guess. So we'll say it's the space between the lungs. So this would be the heart, part of the bronchi of the lungs. I think they even say trachea too. This also includes the sac around the heart. I think our thymus is technically included, but it really is just the space between the lungs where our big focus in lecture is going to be. And then we have our septum. We have a septum in a lot of different places. A little piggy face. So if this is the, we can call it a dividing wall, if you want, that separates the right side from the left side of the heart. So when I draw my heart like this, you guys, like the 4 chambers, this is what we call our septum. Okay, it's just a dividing wall. Yeah, it separates. Very good, Taylor, I like that. Good job. And then we have a couple clinical terms. What do we have the medical term for a fast heart rate? Anybody know? Tachycardia. And I always remember tachy, like your tachometer in the car tells you how fast you're going, right? So you just break down the word fast heart. Remember, break down over words. We want to do that with every medical term we come across, if we can. Some of them don't follow the rules. And then we have a slow heart. So we know cardia is involved. Bradycardia, very good. So again, clinically, when you're doing an exam on a patient, you can use these terms as reference points. Yesterday, because of one of the drugs we were using on that mean kitty that needed his fur shaved off, he had bradycardia, like a son of a gun. But it was expected because that's one of the big side effects with this drug. Okay? And then we have auricles. Does the AU give you any hint to what these might be? I love you, good job. It is the ear flaps of the heart. So the auricles really have, I don't want to say they're not important. They're there for a reason. The big reason, though, that we really use them for, honestly, guys, is when we dissect the heart. The auricles help tell us where the atria lie. So it's kind of just a guiding point, an anatomical landmark, if you will. But really, these guys, these ear flaps lie on top of the atria. And we'll show you pictures of those as we get into lecture. But again, yes, you see the AU, and that reminds you of your ears. That's exactly right. All right, and then raise your hand if you can come up with the medical term for heart muscle. You learned the root word for muscle last week. You know the medical term for heart. We went over it a couple times, obviously. It's cardia. What is it? It is myocardium. Myo is muscle. Cardia is heart. Is pertaining to. And when I break it down, I would suggest you do it in your notes too if you're not studying medical terminology as part of your study sessions. Because you do want to remember your pertaining to suffixes. Okay? And again, it's not hard to build these words if we just put a couple terms together. I feel like I hear a little static, but it's not as bad as it was. Do any of you guys hear static?
Yes.
Is it affecting you? Is it going to bother you?
I didn't even realize it until you said
Until I said something.
Now
That's one of the reasons I haven't in the past is because we get a little bit of this feedback. And I'm not sure if it's the mic, or if it's just that. I don't know. Okay, we'll keep going. Again, if it gets too much, let me know. All right, just let me know. We can figure out a different way to record my lovely self. I've actually had a lot of students record with their cell phones before, not using video. Yeah, I'm fine with that if you just want to have voice recording. Again, don't let your parents listen to it. I'm just joking, you're all adults, right? I've never had luck with doing the videos. So I'm okay with sound recording, absolutely. All right, so a couple other terms that relate to the heart is contraction and relaxation. We talked about this a lot last week, right, with muscles, but we're gonna come up with a couple different terms that relate specifically to the heart contractions and relaxations, and that is our systole. So systole is what we say when the heart is contracting. You guys have maybe heard of systolic before. That's pertaining to heart contraction. A lot of times when we reference systolic, we're talking about blood pressure, which again, goes back to how much the heart is contracting. Oh my gosh, full circle already. We're only 5 minutes in. All right, and then relaxation is diastole. Raise your hand if you can give me the term for no contractions. Sorry, you already had one. Raise your hand next time, but very good. Asystole. Love it, you guys. Just remembering that the A prefix means without. So asystole is what? A flat line. No contractions, no relaxations, nothing happening. Right? All right, so the heart is important, right? Yes, totes, we all agree? But it's the cardiovascular system in its totality that makes things work, right? We have to have all of our vessels, right? So that's where we break down all of our vessels into a couple different categories, okay? So we have arteries and we have veins. And what kind of lies at the center of this is what we call our capillaries. Couple things that we want to reference with each of our vessels. So first, arteries carry fresh O2 blood. Arteries also carry blood away from the heart. Arteries away. Okay? Because it's fresh blood being carried away from the heart to all the tidbits in my body. Right? Veins is pretty much the opposite. So deoxygenated blood, bad blood, you take singing Taylor Swift. And this carries toward the heart. And then the thing we want to reference about capillaries, just real quick, and this won't be the only time we talk about capillaries because they're actually the most important part of our cardiovascular system. Fight me on it. The capillaries are one cell thick. These guys are tiny. They're not really vessels. They're one cell thick membrane in which the gas exchange takes place. We take the bad CO2 that was in the blood and we exchange it for fresh oxygen. And generally, our lungs are responsible for a big part of that. But we have capillaries all over our body. And again, they're only one cell thick. Okay, raise your hand. If you can tell me the name of the sac around the heart. Sorry, you already did one. Yes, Seth. Pericardium, exactly, or pericardial, sure. Because we remember peri means around. Right, so pericardial sac is the sac around the heart. See how easy that is to build words? Cool. And then you guys remember the pacemaker of the heart probably from last week? Anybody? Sinoatrial node or SA node. Yeah, Allie.
Oh, I was gonna answer that.
Oh, I see. I'm sorry. You were raising your hand like a good kid. I'm so sorry. I'm so sorry. All right, we're going to talk all about all of the different chambers of the heart and how they are important in and of each of themselves. But one of them is probably more important than the others. Any guesses on which chamber that might be? It is. So again, remember our right side and left side. It's our left ventricle. And the reason for that is because he's going to pump blood out to our entire body. So the force of his contraction needs to be strong enough to send all of that fresh oxygenated blood all the way down to my pinky toenail. Okay? All right, so that gets us into the heart. How do you feel? All right, it's Monday for you guys. I know. All right, so I, again, totally forgot to pronounce spelling for you guys last week. I don't know what is wrong with me. Didn't I forget to do spelling pronunciations?
Oh, we did.
You did? Okay, good. Then I'm not tripping. Great.
I remember.
Well, I'll pull them up. No, we didn't because we have Purkinje fiber twice.
Yeah.
And I've only said it once.
Yeah,
That's how I know.
We're on week 5.
Mhm. No, we haven't. I wasn't tripping. Hey, at any rate, we're going to go ahead and pull up the terminology words, and we'll just pronounce week 5 words. It'll get us nice and warmed up for lecture. Okay, fun facts. I only have 2. I don't know why I suck so bad on this week when I had like 6 last week. Okay, so your arteries and veins and capillaries make up 60,000 miles. 80% of that is just your capillaries. I mean,
Say that again, I'm sorry.
so arteries, veins, and capillaries make up 60,000 miles in your body. 80% of that, so like 40,000 miles, is capillaries. And they're only 1 cell thick. Okay? Pretty cool. Pretty cool. All right.
Excuse me. So you have a bruise, it's like all your bones.
What's that?
Like a bruise, it's like your capillaries.
Not necessarily just the capillaries. It's probably little veins and vessels too. Yeah. All right, week 5. This is what we're going to test on Thursday. All right, so we have auscultation. What is that? Hearing with your little ears, your stethoscopes. Usually I call them ears. And then we have our chordae, mediastinum, systole, whole body Purkinje fiber, saphenous, pericardium, autorhythmic, interventricular septum, and endothelium. Sweet. We've got GI, one of my favorites, and then nutrition coming up. So try to remember to say those after we do our spelling. I just have been failing miserably. This week is sad. I'm gonna just warn you guys right now. Okay, so like don't be offended when I try to crack hella jokes tomorrow during all of that sadness. Okay, so before we jump into the actual lecture, we have just terminology basics to go over. So I'm gonna try to go through the terminology with each body system before we do the big lecture, but you'll see a lot of repeat terms, which hopefully guys doesn't bore you or frustrate you. Again, the more you're hearing something, the more you're reading it, when you're doing your homework and all of that stuff, it'll help to make it stick. Let me just say also, just real quick, how'd you guys feel about the exam? Not too bad, right? You didn't do too bad at all. And now you kind of know what to expect, right? Some of you guys did pull some pretty funny jokes, or at least made it clear that you were trying with an answer, right? And that's all I ask, really. I think you also maybe saw my generosity. Okay, and thank you. I appreciate that. I try to throw a point if I can. You know, if I can, I can. So just do your best from here on, guys. That's all I can ask, right? But getting the first set of tests out of the way, what a good feeling, right? Because now you know kind of what it's like. All right, let's do this thing. So this is just out of your terminology. You can either follow along or not. What I would suggest, though, again, in an attempt to study for these body systems, is go back to Chapter 8, Heart and Terminology, and go through some of those worksheets, right? It'll really, again, help to jog your memory and make things stick. All right, so I always reference, you know, we're doing the heart. Again, that's not fair. It's the cardiovascular system in its entirety that we discuss in lecture today. And part of that is, again, the veins, the vessels, the capillaries, all of that jazz. You guys already know, again, about the exchange of gases, right? We want to trade in the bad gas for fresh oxygenated gas and transport that waste where it needs to go. Right, and generally that's breathing it out. Thanks, buddy. Thanks, man. Otherwise, though, the blood, and we'll have a whole system on blood itself, you guys. It is considered a connective tissue, sort of kind of its own body system. But the whole purpose of blood, obviously, is to deliver that fresh gas to all of the tissues in the body. It can also, of course, deliver hormones, drugs for us, all sorts of stuff, right? So cardiovascular means pertaining to the heart as well as the blood vessels. So vasculo is our root term for the vasculature. Again, the heart's a hollow muscular organ that kind of works like a pump, again, to draw blood to and from the heart. Again, the heart's located in the mediastinum, hanging out between the lung cushions. Nice little place to live. All right, so we already talked about the pericardium. Clinically, the pericardium is quite important for dogs in congestive heart failure. What tends to happen is fluid builds up in the sac around the heart. It makes it pretty dang hard for the heart to pump. Makes it hard for the animal to breathe. It's pretty serious. Again, you know peri means around. The pericardium has a couple different layers to it, and these layers allow for that heart to move constantly without creating too much friction or heat buildup in the thoracic cavity or in the mediastinum. So we have two layers of pericardial sac. We have the parietal layer, which is the outside layer, and we have the visceral layer, which touches the organ we're referencing. Okay, you're going to see parietal and visceral layers in the GI system too. They are the same things. Heck, guys, by Thursday, we have a visceral and parietal layer around our lungs. Same thing. They are there to kind of work like two bags rubbing against each other, right? Kind of allows for a little bit, again, of that reduction of friction. We're talking about organs that are moving constantly, such as our heart and our lungs. Okay, so make sure you know visceral is the one that's touching the organ. And our parietal is the one on the outer layer. Inside the sacs, we have pericardial fluid. It's normal, very small amount. Again, it kind of helps to lubricate these two sacs. It is not common for us to remove normal amounts of pericardial fluid. The patient needs that. That's normal. But again, in cases of disease processes or pathology, we can actually remove fluid from between the two sac layers of the heart. That is called a pericardiocentesis. Remember centesis, drawing fluid out with a needle? Generally, veterinarians are the only ones performing pericardiocentesis. Often you guys can do thoracocentesis, but pericardial, again, you're aiming for a layer between two layers, right? That's generally going to be what the vet does, probably most likely ultrasound guided. You don't just go stabbing around the heart sac without seeing what it is you're stabbing, right? Yeah. All right, so the heart is a muscle, right? We have a couple different layers here. Oh, did I take my clipper? I was gonna try to get new batteries for it, but I failed at life. So the myocardium, again, our muscle. The outer layer, our epicardium. Just like we had epimysium last week, right? The outer layer of the muscle, this is the outer layer of the heart. And then we have the endocardium. So this is the layer that's within the heart muscle. Endocardium is actually pretty clinically important. Anybody know why? This is actually something that happens in humans too. So 80% of our patients have some level of periodontal disease. When it is very severe, what winds up happening is the animal is inhaling all of that really gross bacteria 50 million times a day. Some bacteria in the mouth love the heart, and they will actually find themselves through circulation living in the endocardium. And then we have a clinical disease process that's called endocarditis, where the inner layer of the muscle is inflamed. Do you think that's good for business? No. It's going to cause some issues with that patient. Okay, remember your layers. They're pretty easy, right? Same terms that we've heard a couple weeks in a row now. Into the vasculature, we have our coronary vessels. Anything that sits kind of on top of the heart, we can reference as coronary vessels. This is an important area where blood is entering into the heart from the bod, and where blood is exiting from the heart to the bod. Two very important doorways into the heart with all of this vasculature up here. So our cranial vena cava, just this blue guy right here, is our biggest vein, and he's bringing all of our bad blood back into the heart to get exchanged for fresh blood. In pigs and guinea pigs, you will actually use this as a point of venipuncture. We don't do it in anybody but pigs. Okay, and then just as important as the cranial vena cava is our aorta, which is going to be our biggest artery, which supplies the whole body with fresh oxygenated blood. Some of the other terms they have here, coronary occlusion, if any of those doorways are stopped, can lead to what we call ischemia. Ischemia is a lack of blood supply to any area. What's going to happen when you don't have blood supply? You die, or that piece of tissue dies. All right, so necrosis is our death, condition of death. So ischemia leads to that, not good. And then we also have, when we have an area of of dead tissue, we can call that an infarct. Now, sometimes you'll hear more referenced in human medicine with heart attack victims than we usually reference, but we can. Okay. So we'll talk about all of these bits when we get into lecture. So we're going to need to know quite a bit of them, okay? So the top of the heart is the atria, or atrium. You have a left and right. And then the bottom that makes up the V of the heart are the ventricles, okay? My biggest goal, guys, with the cardiovascular system, beyond obviously getting through lecture, the biggest goal that I have for this body system by the end of this week is for you to be able to road map your way through the heart. So that pretty much goes kind of like this. You guys will get there, promise, by Thursday, okay? This is just a really quick little reference. You're gonna start with the cranial vena cava, come into the right atrium. You're gonna go through the tricuspid valve into the right ventricle. You're gonna go into the pulmonary valve, into the lungs. Okay, gas exchange takes place. Bad blood has become good blood. Now it's gonna come back into the heart through the pulmonary veins, into our left atrium. And it's gonna go into the left ventricle and out through the aortic vein. Okay, it's like 12 steps. You'll have it memorized. It's a must, okay? So many questions on the Vitney related to cardiac anatomy, reference that, but I think it's also important to really know the entire system. So it's what we're gonna get to, okay? So your atria and your ventricles. Again, the septum, dividing line, right, dividing wall. And then our apex. So the apex is the tip, okay? We call this the base. I know that's backwards, isn't it? But this is the apex. An apex is a point, okay? I have an apex on my teeth, okay? And the base is the big fat part. And then we have in between all of the chambers of the heart, as well as our big veins, we have doorways or valves. The valves are really important. Okay, so we need to know our valves and we'll learn those. So valvo and valvulo reference the heart valves. I'm sorry, I'll tell you ahead of time that the heart valves have 5 different freaking names each. Sorry, not my fault. So the right atrioventricular valve, so that's the doorway right here. It separates the atria and the ventricle. That's why it's called right atrioventricular valve. It's also called the tricuspid valve. You need to make sure you know both. I think the right AV is pretty easy, right? Because that's what side it's on and that's what it's dividing. So that's kind of easy. What's sometimes hard to remember are the other weirdo names. Okay, we have a couple ways to help. Oh, great. Am I going too fast? You guys doing okay? I'm seeing some like. Yes, Jess.
What did you say was the other name? Tricuspid?
This is tricuspid. The left AV valve is bicuspid and mitral. So the way I remember it is you try before you buy my stuff. Try is on the right, so try before buy. We always start on the right side of the heart. Do I need to take it back a notch? Yes?
Yes.
Okay, we can do that, no problem. Let's go back through it. Don't get overwhelmed, guys, okay? Don't get overwhelmed. I know it seems like a lot. It is a lot. Don't freak out though, okay? So let's go. You know what, I kind of like these pictures better. Okay, so just real quick breakdown. We have the heart muscle itself and we have all of the tubies that lead to it and go from it, right? Okay, so anytime that we say something is coronal, so like a corona, do you guys know what corona means? Well, king, but different story. So it's a crown. So coronal means I just put a crown on her head. She's a queen or a king, okay? The crown of my teeth, the white part, we reference as coronal because it's the crown, okay? When we talk about coronary vessels, it's the crown of tubes that sits on top of the heart. If this is the face and head, this is the crown. I know I don't say that right. My dad makes fun of me all the time. Crayon and crayon. Let's record that. So the coronary vessels are important. Maybe I emphasize too much. Don't trip on them too terribly hard.
How would you spell that?
What?
Coronary vessel. Is it?
coronary.
Okay, gotcha.
Yeah, so coronary vessels are all of this crap. Okay, so it's the aorta, which is the largest artery, the vena cava, which is our largest vein. Okay, you guys, I have that stuff on board stuff tomorrow. It'll be a nice little reference. Doesn't mean you have to know everything right now, right? Okay. And then when we talk about the heart itself, these little guys, where they're pointing at the left atrium right here, it looks like a chunk of meat sitting on top of the heart. Those are the auricles, the ear flaps. They kind of look like little ear flaps on the heart, don't they? Right? But that's just, again, kind of where we know the atrium lie under them. So they're just a landmark, okay? And then when we skip ahead or back to our picture here, let me see if I can make this bigger. Okay, when we skip back to our picture here, this kind of is broken down halfway like this and halfway like this, okay? These little white stringy thingies, these are what's called chordae tendineae, and they're the heartstrings that control the valves. Okay, so I know it doesn't quite look like when I draw the heart like this, right? But that's really kind of how it's broken down. We have 4 quarter sections. We have the right atrium that receives the bad blood, shoots it down here. Okay, from here, we're gonna pump into our lungs. Gas exchange takes place. We're gonna come back into the heart through the left atrium, into the left ventricle, and out into the whole body. Does that help? Okay, all we're doing now, guys, is just adding the doorways into that, okay? So when we say bad blood, which again means deoxygenated, full of CO2, when it needs to come back to the heart to get exchanged for fresh, it comes in through the vena cava. It comes into the right atrium, and it goes through the tricuspid doorway. It's just a doorway. Okay, the valves help to kind of regulate pressure to a certain extent, but really blood's just passing through. Okay, that's all it's doing. So it's in the right atrium, he goes through the tricuspid doorway, and now he's in this big chunk, the right ventricle. Okay, again, the right ventricle, he's gonna lead up here to our pulmonary arteries. Pulmonary means lung, okay? This is a point also, actually, no, let's not go there yet. It gets trickier, huh? He's gonna go out to the lungs. Okay, all the bad blood turns into good blood. You gotta come back into the heart. I think there's a common misconception with people who don't have medical background that the heart does it all at once. No, the heart takes in the crap but has to send it to the lungs, technically, right? So that's a piece that I think sometimes we forget. We have to travel to the lungs through the pulmonary arteries. Okay, we get into the lungs, we have gas exchange, now I'm fresh, I need to go to the pinky toe. I come back into the heart, into the left atrium. I'm fresh and happy. I'm gonna go through the bicuspid or mitral door into the left ventricle, where I'm gonna get pushed super fast and hard all the way through the whole body. Does that help? Yeah. Okay. Guys, don't trip. Don't trip. I've got worksheets galore that'll help with this specific part, okay? Guys, you know, one of the ways that I did it when I was in school, because this was hard for me to get too, because what did I know about the freaking heart? Nothing, except for it went bump, bump. And we had to do this too. And I was like, why is there so many steps involved? So the way that I wound up breaking it down, and I'll put this on board stuff for you guys tomorrow too, is instead of drawing the heart like this, I don't even draw the heart. I just go, right? So again, if I'm starting on the right side of the heart, what's my first step? My vena cava, bad blood, right? And then I'm gonna do my atrium, I'm gonna go through the tricuspid door, right? And then I'm gonna go through the right ventricle. And I'm gonna go through the pulmonary door, because he's actually a valve too, technically. Now I've got fresh gas. The left side is gonna get the fresh gas, because all of this is pretty much all bad, 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 until we get to the lungs, right? And the left side then is coming back into the left atria, the bicuspid door, the left ventricle, and the aortic valve. And then I'm in the body. Okay, so if we look at it like that, okay, it's maybe more than 12. Let's see, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 steps. 10 steps to cardiac circulation. Yeah, definitely. So yeah, your textbook for sure has it. I'll be the first one to say though, Haley, that shit confused the hell out of me. It always did though, right? Like the color schemes, and then some of the pictures are not right left oriented. So I had to like come up with my own schematic, right? Yeah, use your resources, but if you have to, if you think a different way, maybe this helps, right? I think sometimes just looking at this, it's like, what? Where do I even start? Right? I know it's really new to you guys. And try to make it easy in ways that we can. But yeah, you definitely have a lot of little guides in your book. Okay, so I'm gonna keep going. Again, don't get too overwhelmed, okay? This is just the terminology piece, okay? Lecture will definitely help you feel a lot better, I think. Okay, so this is just, again, referencing the other valves. So the left AV valve has 3 names, I'm sorry. But I always remember, try before you buy my. Okay, I don't know if that helps or not, but try is on the right, buy my is on the left. So try before you buy mine. All right, and then we have the other doorways that I just referenced are called semi-linear valves. And that's just in reference to their shape, right? But we have our pulmonary valve and our aortic valve. So pulmonary means what again? Lungs. So it's telling us where it's taking us, right? And then same with the aorta, it's telling us where it's taking us. The aorta being the biggest artery, and arteries travel which way? Away from the heart, okay? So they're telling us where they're taking us. All right, and then EKGs, guys, we don't talk anything about EKGs until you get to emergency class because it's its whole own little thing. But what you want to reference to it now is that the little wave guide that we get on paper or on digital whatever device is an actual representation of the contraction and relaxation of the atria and ventricles of the heart. So again, it's an electrical representation of the relaxation and contraction of the heart. That's really all you need to know for now about that. We talked about the cardiac conduction system last week a little bit. So you have the SA, the AV, the bundle of His, and Purkinje fibers. So this is a nice little drawing of that. Okay. Some of the terms we already talked about, you guys already know all of these. Arrhythmia, A means without rhythm. Or you can call it dysrhythmia, some people do. What does dys mean? Bad rhythm. Either one's appropriate, right? But an arrhythmia is lack of rhythm. All right, and then your Brady and Tachy terms. Guys, we're gonna talk respiratory terms as well. Fast breathing, tachypnea. Slow breathing, bradypnea. Same terms, same prefixes, okay? Don't worry, we'll cover that by Thursday. Again, with the EKG, this is just a picture showing it being done on this guy with like a machine from the 70s, it looks like. Ours are a lot nicer. It's a really simple procedure. What's difficult is sometimes interpreting them. Again, we will learn the P wave, QRS complex, and T wave in emergency next semester. So don't need to know anything about that now. But we do need to know about ausculting. You guys will auscult all your patients as they come in. Feeling a pulse is also recommended, but we teach to auscult and palpate the pulse at the same time. So you want to be listening at the same time that you're feeling as well. And what you're listening to, the actual sounds of the heartbeat, are those doorways that we talked about, opening and closing. Now there's cases sometimes where your doors in your doorway, your valves, have become worn out and flappy. Or they just weren't made right by God. And we have heart murmurs, okay? So heart murmurs, this is important to know, is not a problem with the muscle of the heart. It's a problem with the blood flow through the valves. And oftentimes, depending on what side of the heart you hear the murmur loudest on, you can determine exactly what valve it is based on anatomy, based on what you know is right side and what you know is left side. Okay. All right, so we talked about vessels, arteries, capillaries, and veins. We do have the ability within some of our vasculature to constrict or dilate them. So like vasoconstriction, vasodilation, you'll learn those terms probably in PharmCo, right? So it's the opening or closing of the lumen or the tubage of the vessel. Arteries, again, carry away from the heart. Arterio is your combining form. Small arteries are called arterioles. You guys probably know, like with the lungs, you have your bronchi and then you have your bronchioles. That's just smaller versions. Okay. Words for vein that you want to know, veno, so like venipuncture. And then phlebo, like phlebotomy. We don't generally use that term, but we do use phlebitis when referencing a patient. Blood pressure, something you'll also learn in emergency, just some fun words. The sphygmomanometer is the little thing that you pump up with your hand. So sphygmomanometer is a fun word. You guys get to do that again next semester. Yeah.
So, since I'm going to start with those with the medical history I have, for animals, is it going to be the same blood pressure rate?
No, just not the same rate. No. So you'll learn all normals for all your different species. The way you perform it is pretty much the same. We don't auscult when we do blood pressures. We're getting a Doppler. So it's a gross sound instead of having to listen with your stethoscope. We don't do it that way. So in some ways, maybe it's easier. In some ways, maybe not. But yeah, you guys will do blood pressures. Don't you worry. Don't you worry at all. All right, so that gets us started to jump into chapter 14, which is the actual heart lecture from your anatomy textbook. Now, I want to ask this, but I don't want it to sound like I'm coming off like really rude, you guys. But how many of you have read this chapter? Okay, awesome. So that's like 3 out of 21. I'm just going to say, because guys, I've been there, I've seen it. I'm going on my 6th year of teaching vet tech. Okay, I see when the reindeer eyes come out, I know what that means without asking. Now, what I'm saying, again, I'm not trying to be mean because I know you guys had a hard-ass week last week. I know that. I know. You probably didn't want to jump ahead and like start studying again after studying so hard. I get that. I'm a student too, guys. Did I tell you I'm doing my bachelor's at WSU? I feel you. I feel you. Doesn't mean that you can't get ahead, because chapters like this that are a little bit more hardcore, and I'm going to tell you about GI next week too. If you come in here blank staring me on day one, we're going to have a harder week getting through it. Okay? If you've at least sort of kind of perused the chapter a little, doesn't mean you have to read word for word, front to back, but just like skim it, maybe. It'll help you so much when I'm up here talking and pointing these things out. You'll make these connections in your brain, okay? If you think that you're gonna get everything you need to know from the cardiovascular system from me in lecture, you're wrong. Even though I did a damn fine job, it's not all that you need. You've got to be reading the chapters, okay? Just got to. So, I know. There's no denying this, okay? What I would say, guys, is I'm hoping to be done with heart by tomorrow. So maybe instead of, skimming heart tonight, maybe go ahead and skim respiratory, just so that that makes a quick end of the week for us, right? So as we're learning all of those little tidbits, you're making those connections a little easier, okay? Okay. Good, sorry, don't mean to yell, just wanna make sure you got it. Okay. Chapter 14. Maybe. All right, we've covered most of this, thankfully, right? By doing our little bit of a terminology review, we did a little bit of this. So we know our veins, we know some of our vasculature. Again, we know that it's kind of a pump, pretty basic. So the book references this as kind of a figure-8 system, and it is, in terms of being in the heart, exiting, going into the lungs, and kind of coming back to the heart. I think of it more as the infinity sign, though, instead of a figure-8, which is up and down. The infinity is kind of side to side. Yeah, it's the way my brain thinks. But we have two different types of circulation. So the first one is pulmonary, which again, we know what that word references. It means lung. So it's a specific circulation that's taking place when the bad blood goes into the lung to get that gas exchange. And then we have systemic circulation. So this is the whole rest of the dang body. This is the blood that's going down to my pinky toe and eventually coming back up to my heart, okay? So systemic is a word you've probably maybe heard before pertaining to the system, right? You'll probably see that in Pharmco. Some drugs are systemic, some may not be. All right, so the basic heart itself, we kind of already talked about this a little bit. So the base is the fat part at the top, okay? The apex is the point. You can see the left ventricle is huge. It's huge compared to our right ventricle. And then we have our ear flaps. So again, these kind of like little chunks of meat that sit like ear flaps on the heart. Again, they're just there as a landmark to tell us the atria is under here, okay? I know that apex threw me off, I remember, when I was in vet tech school. What? That doesn't make sense. So the heart, again, sits in the thoracic cavity between the two lungs and the mediastinum. The point of the heart does shift to the left ever so slightly. Some clinicians that I know and nurses that I know have a preference to listen on the left side as they think it gives a clearer sound. It probably does, because again, the point of that muscle is closer to this body wall than this body wall. So as you guys are learning to sculpt, let me ask, how many of you guys who have stethoscopes at home have listened to your pets? If not, why? Yeah, for sure. That's the most annoying sound ever. Like, stop purring.
That's funny. And then you turn on the water, and then all of a sudden it's gone.
Sometimes it works, sometimes it doesn't. I will alcohol them sometimes too. You do what you gotta do. My cat does not purr in clinic. Cats who purr in clinic should get a reward for their niceness. So yeah, the apex does sit a little bit more to the left. So as you guys are learning, maybe listen on the left side, right? You might hear it better. But don't worry, it won't be too long now before you guys are doing this stuff in lab. So again, the pericardium we talked about. This kind of shows the picture a little bit. My laser's a little bit shaky here today. I don't know why. But our visceral layer, again, touching the heart itself, and the parietal as the outside layer. Again, it's within these sacs where we have this fluid, the pericardial fluid. You can see the heart really does sit on that diaphragm. Remember, the diaphragm sits between the thoracic cavity and the abdominal cavity. I don't know why, but I used to think like my lungs were down to here.
I still think that, even though I know, I'm just like, they have to.
They're not though, they're not. So if you know where your xiphoid is, which you guys all learned, your diaphragm really is a little bit cranial to that and across. So your ribs, I mean, again, yes, they're very protective, but the caudal half of your ribs aren't really protecting any of your lungs. They're protecting more your liver and other abdominal organs. So your lungs, I mean, when you think your lungs are all the way up here, I don't think a lot of people think that. They are. Yeah, my most cranial lobes. They sit quite high. And the same with animals too. And you'll see on x-rays too, it looks like it's almost up in the shoulder. I don't like this to a certain extent. All right, and then muscle layers again. So our epicardium on the outside, myocardium as the chunk of muscle, and then the endocardium as the innermost layer that can be affected by bacteria. And then the internal anatomy, just another little schematic for you guys. So using kind of color codes to show right atrium, right ventricle, out to the lungs, back into the the left atrium, left ventricle, body. Okay, you guys all have that down pat, don't you worry, I got you. Did I lead you too far astray on your exams? Okay, do what you need to do, right? And I won't lead you astray. I can't do it for you though. All right, we already talked about the atria, so the top rooms of the heart. This is where blood is received from both the body and from the lungs. Yes, we do have a septum here also. Again, that's just dividing the two rooms from each other. When the atria fill up with blood, the atria contracts and squeezes all the blood down into the ventricles. Okay, when the ventricles get full, they're going to squeeze it up either into the lungs or into the body, depending on what side we're talking about. How many of you guys, oh my God, what did it used to be called? Okay, Taylor, oh, my Hutch kid, she's gone. Okay, there's a hotel in Hutch. It's called the Atria now. And like, I can't even drive by it without like chuckling to myself. But there's like big buildings, like palaces and stuff that have an atria. You guys ever heard that? Like as an entry room, right? It's exactly the same thing. I can't remember what it used to be called, but it used to be a really cool place, and now it's not. And they call it the atria, and I'm like, that's weird. But it is the entry room. And then our ventricles pump the blood out of the heart. So again, they either pump it out to the lungs or out to the body, depending on if they're left side or right side. Okay, so the ventricles, it makes sense that the ventricles make up the bulkiest part of the heart. And it makes even more sense why the left ventricle is slightly bigger than the right. So again, that left ventricle is sending all the blood to all the body. He's got to be pretty dang strong. Again, the little auricles right here. Interventricular groove is just the groove that we kind of can make out here between the two ventricles. So again, interventricular, between the ventricles. The heart can actually be quite fatty, and this is true in animals also. And when we see a lot of that buildup, it is harder to reference some of the some of the landmarks. And then our valves. So again, with our valves, or our doorways, we have 4 big ones, okay? We have one on this side that separates the atrium ventricle, one on this side that separates the atrium ventricle. And then we have 2 going out, okay? The 2 going out are the pulmonary valve, okay? The pulmonary valve takes us where? Lungs. And then we have the aortic valve, which takes us where? The body. I would, if you have not yet this morning written down that the aorta is the largest artery, which carries blood away from the heart, I would note that. If you have not. The aorta is the biggest artery. Arteries carry blood away to the body. And then we talked about the heartstrings. So the chordae tendineae really are these little heartstrings. I mean, you guys, on the necropsy that you guys will do either very end of this semester or very beginning of next semester, depending on when Doc has a dead body, you guys will dissect the heart, and you will be able to appreciate and dissect the chordae tendineae, even on a cat. Cat heart is like this, like a cherry tomato. So it is something you can actually really see. And these things help to keep the doors from staying open all the time, right? They kind of help to spring back a little bit and close the door so that the atrium can fill up. Because if the door was just open all the time, there wouldn't be any pressure. So the door has to close, pressure builds to a certain extent, we're pulling all the blood from the vena cava until this fills up. When that fills up, the door will open, sending it into the ventricle, okay?
Sorry, I was just, so when you have like a valve issue, like the
Mhm.
doggy has heart,
Yeah.
is it the chordae tendineae an issue
Depends.
of? Like, does it get just leak?
It depends. It definitely can be. It can be that the valve itself is starting to degenerate. Oftentimes what they'll do to really fine-tune diagnose is an echocardiogram. Do they have that there?
Yeah. they have
Awesome.
that.
Okay. Well, and sometimes you don't need to go that far or spend that money. But yeah, it can definitely be just a degeneration of the cords themselves, of the valve. When you think of the valves, guys, it's like closing your car door. It has to do it just right? And if one little piece of that black rubber thing is off on your car door, it doesn't close right? So it's kind of the same with like the valves. If they don't really snugly fit into place and one corner's off, blood flow is gonna get through and make that weird sound that we hear as the murmur. So yeah, it's hard to say.
Yeah.
Is this your king? So it's genetic.
Yeah.
So it likely is just the way God made her. And that's a nice way to say it, right? Not blaming you, God, I'm just saying. I mean, you never know though, you never know. But yeah, you've had a classic little dealing in all of that lately. With Breeze. What were you gonna add?
This picture's flipped.
It is, and I hate it, I know you guys. I didn't want to say anything because that would like throw some people off. I'm like, fuck this. It's all tough. I know. So the way that I learn and the way that I teach is always right side. Always right side. And I think I probably just said, this is the right atrium and it's flipped. I don't know why they do this to us. I don't. They don't. But they're making sure that Sam Clover's paying attention. Oh, what did the Atria in Hutch used to be called? That hotel. It used to be like the big thing back in the day. We had like homecoming and proms there.
Oh, yeah. They used to call something different.
It was way fancier too.
It got shut down.
Is it?
Yeah.
It's not the Atria anymore.
It's like a crap.
Oh my God. I do not doubt that. Yeah, Sam, you're not wrong. So what she just said is this heart schematic is flipped. I don't know why they do that to you. Anytime that you see one that has the left on this side, that's true to you, left is wrong. Okay? The way that we need to orient ourselves with anything or anybody is like I'm facing them. Okay, Gabby, shake my hand. Are you well?
Are you?
So right side, okay? Left side. That's how we need to orient ourselves to this and everything else that we learn, okay? And I know that's kind of weird to some people.
No, that's good. That's like a good.
If it helps, guys, I will be sitting there on the x-ray table with an animal and I'll seriously reach for his right paw to shake because then I know that I'm oriented correctly. So don't judge. And I'm left-handed and I'll still do this to myself. I can tell you're judging me. Okay, let's do 1 or 2 more and I'll send you guys on break. Yes, Sam, I know. I don't know why they do that. It is annoying. But if you learn it in order, you'll know which sides are what, right? Even if they do flip it on you. Okay, so this is actually kind of cool. The heart muscle is a very strong, powerful, thick muscle. But he is not his own structure. We do have sort of kind of a skeleton in the heart. So you can see we've got shapes created here that are really, what do they call it, connective tissue. It is kind of like a dense cartilage, more than it is true bone. But it kind of shapes for us our outline of our valves. So this kind of gives the muscle something to hang on to and for the valves to build off of, right? It's kind of skeleton. And then the root of the aorta, as well as the pulmonary branches of vasculature. I won't ask you anything. This is just a, oh, huh, isn't that cool kind of thing. Right? We think of the heart as just a muscle, and it really is, really. But we do have some structural support that, again, gives the muscle something to kind of build onto. You know, I think of a baby growing in the fetus, and this is what first happens, right? When we're all just big chunks of cartilage. And then when our muscles and organs start producing, this is what they're building around. And isn't that amazing? Truly. Right? So again, yeah, anchors the valves, point of attachment for muscle, electrical insulation, kind of important. We overlook that sometimes. Just kind of cool. And then again with the blood supply. So I don't know if you like this picture better or not as far as the coronal vasculature. Yeah, right, I don't know if I like it or not. But again, it just shows everything that sits at the top. Okay, so it's like I just put a crown on his head. Okay. With that, why don't we take a break? How about a good 15? We'll come back at 11:20 and get through a little bit more. Okay? You guys are doing good. You're hanging in. There we go. All right. It's weird because I can't minimize the screen. Okay, so picking back up into the heart, so much of this, again, is just really basic anatomy, right? So the coronary arteries and veins, again, ones that are sitting at the top of our heart. Now, we talked about this a little bit last week when we were talking about the cardiac muscle cells and their fancy intercalated discs and the fancy nervous system that runs the heart only. So this is pretty much what it's referencing again. So nerve supply to the heart, again, not essential. And again, why we can have you know, things like pacemakers or transplants or that kind of thing. But it does have innervation, if you remember, from 2 different nervous systems. You can start on board here. Do you remember what those nervous systems, we reference them as the ones that make our heart speed up super fast or slow down? Yep, so fight or flight, which is sympathetic, and then our parasympathetic, which is the rest and digest, which is calm down, right? So we talked about that a little bit, but really he maintains his own pattern, his own rhythm himself. Really, truly, it's the SA node, right? All right, so again, a different little schematic. I don't know, this one's okay, I guess. It kind of shows a little bit more of the body. So this is our heart and lungs, right? So this is our pulmonary circulation, and this is the whole rest of the body. So what it's showing us just specifically with our liver is we have an aortic branch that supplies the liver with fresh blood. So the liver can do what he needs to do. Okay, the bad blood gets picked up from the liver's capillaries and gets picked up into the vena cava that branches also out of the liver. So it's just kind of showing you all of our big organs and the blood supply, both fresh and then deoxygenated blood on its way back to the heart. So when I said that we have those capillaries all over our entire body, 40,000 miles of capillaries, this is kind of explaining that, right? We have really big arteries that lead into these organs or lead into our muscles. But again, it's through those one cell thick capillaries that gas exchange takes place, the bad blood gets picked up and goes off to the heart. Do you guys like this picture? It works, it works. Okay, so again, systemic means the whole system or the bod. All right, and then the cardiac conduction system. So we talked about this a little bit last week too. So we have our SA node, right? The SA node is going to lead down to our AV node, right? So this is all right-sided. So in the right atrium, we have our sinoatrial node, pacemaker, our atrioventricular node. And then as we come down the septum, we have our bundle of pins, okay? And I drew it, I think, just as one line, but you can kind of appreciate here, we have one line for this side of the heart, the right side. Okay, so the bundle of his, the bundle of his. And then as we turn the corner and come up, the ventricles of the heart, that's where we have our Purkinje fibers continuing to carry that electricity. Yes, yes.
So when it's talking about the connection system, it's not talking about the way the blood flows. It's talking about
Electricity only.
contracts.
So, yes, but it also has to do with relaxation. So let me put this together for you. So we have our electrical conduction system, okay? So this is all of the nerves and fibers and bundle of his and all of that. And then we have the EKG, which I know we don't talk about yet. It's a whole different side of things. What the EKG was referencing, if you'll remember back to the terminology lecture that we did first, that like the P wave has to do with the right atrium contracting, whereas the QRS complex has to do with ventricular relaxation. And then the T wave is picking back up. Don't quote me on those yet. We'll cover that next semester. But that's how it's kind of referencing on an EKG paper pattern what's happening where with the electricity of the heart. Now, I don't know if this helps or not. This is kind of maybe off. There used to be a lab that I would do with my students, and I kind of have put it to the side because this week is a crazy week and we just don't have time. But in the future, maybe we can dig out the supplies and do this lab. But in an attempt to replicate how the heart produces its own electricity, we would take old school old school flashlights, where you can take the batteries out the back, and you would take a sponge, salted to hell, a salty, salty, salty water sponge. You put it on the back of the batteries, the flashlight works. And that's kind of how the heart works too, in terms of its own conduction through minerals like salt, calcium that we know controls muscle contraction. So through all of these different compounds or elements, we're able to sort of kind of create electricity. Is that exact to how the heart operates? It's freaking magic, guys, right? Your heart pumping normally right now is a miracle, right? So it is, it's a little bit the same, a little bit different. But as long as you know the cardiac conduction 4 steps, SA, AV, bundle of his, Purkinje, we're good, okay? Okay. All right, and then the cardiac cycle. So one cycle is one heartbeat. Okay, one heartbeat produced in one cycle. One cycle is defined as a contraction and relaxation. So again, we have our systole, which is the actual muscle of the heart working to contract. And then we have our diastole, which is relaxing and repolarizing. And this repolarizing and depolarizing, we're going to talk about a lot when we get to the nervous system, which is kind of like the heart electricity. Okay, so you'll see those terms again. Again, each chamber of the heart is going to go through contraction and relaxation, but not at the same time. If we had that, we wouldn't have a nice pump action created between the chambers of the heart, but they all do contract, and relax. That's how, again, we build up pressure to keep the blood flowing. How does blood flow in our bodies? What's controlling that? Okay, but what's controlling my blood pressure? Okay. No, I love this, guys. You're not wrong. You're not wrong. So we'll learn that blood pressure is actually controlled by your kidneys. That'll be in a couple weeks' time. But guys, the way the blood is pumping through me is controlled by negative pressure in my chest. Kind of acting like a vacuum to a certain extent. And it's kind of helping to suck the blood back into the heart and push it. But it is that contraction and relaxation and the pressurization of the valves opening and closing each chamber that helps with that pull of the vacuum and with that negative pressure.
So is that like inhaling and exhaling?
Sort of, yes, because that does have to do with the negative pressure of your chest, which we'll get to later this week, I promise. That wasn't a trick question, but it really is. Have you ever really sat and asked yourself, how is my blood pumping in my body? Keep that hope. Keep that hope alive. All right, so heart sounds, again, we talked about a little bit. So the sounds that we actually hear when we're scalding our patients are the opening and closing of our valves. So our first sound, our love, this happens after the atria contracts. At that point, we have the tricuspid valves on one side and the mitral on the other shut. Okay, the blood is now in the ventricles waiting to go where it needs to go. So the second sound is that second set of doors. So the pulmonary and aortic doors closing. Okay, again, when we hear a murmur, it's kind of like a whooshing sound instead of a bump, 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 bump. It's more like a whoosh, 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 whoosh. And again, what that means is that blood is getting through the closed doors. That sound of the whoosh is blood still going through the doorway when it shouldn't be. A heartbeat should be nice and crisp. Okay? I won't ask you anything specific to this, but I'll put out a warning. Right? On Bitney Prep, we've come across questions that do ask something to the effect of what are the valves that close on the second heartbeat. And if you remember that the sounds go love, dub, love is the top set of doors. Dub is the pulmonary and aortic, second set of doors. But again, if you don't have your heart anatomy, as far as what's on the right side, what's on the left, and where do they lead to, you might not be able to answer that. Okay, so just a warning, the love dub sounds silly, but it is important to know. Love is first, sound, first set of doors. Dub is second sound, second set of doors. Okay? Any extra sounds? And again, when you have a murmur patient, it's not generally going to be you that's making the complete full-on diagnosis, but if you hear a murmur, move your stethoscope around the heart. Move it to the right side of the body and the right side of the heart. And really try to listen to the peak that you can hear to try to determine what valve it is that's messing with us, okay? If it's high up on the heart, if it's really cranial, that's probably the pulmonary and aortic, right? If it's a little bit lower down, like truly by the animal's elbows, that might be more mitral. Mitral is the most common. So valvular insufficiency is one of the things that we can hear with murmur. So again, the valves don't close all the way. Or valvular stenosis, where the valves don't open completely. And they just kind of flap in the wind, flap in the blow. Okay? You guys, I'll tell you right now, I can't generally determine, because I don't diagnose, I can't generally determine grades 1, 2, and 3. Sometimes I can do 3s. Sometimes it kind of depends on the patient. But we grade heart murmurs 1 through 5. 4 and 5, you can literally look at the animal's chest and see their heart beating all fucking out of whack. You can put your hand on them and feel it like hitting your hand outside the animal's body with a 4 and a 5. A 3, yeah, I could probably hear a decent 3. 1s and 2s are really hard to hear. Some vets can't even quite hear 1s and 2s. One thing I will say, when you guys get into lab, we had a little bit of this yesterday with the cat shave job. He was a bad cat, so we had to drug him. Because he was drugged, we had to monitor him, right, under sedation. It was really difficult to get a nice heartbeat because they had clippers going. So every time that somebody needed to come get a heartbeat, they had to turn the clippers off, right? One thing I'll say is when you guys start listening in lab and you notice somebody has a pair of stethoscopes and they're trying to assault someone, shush, shush, right? I usually don't say it that nice when I'm the one trying to assault and somebody's being loud right next to me, because it is very important, that you really are listening. And I shut my eyes to focus, all my senses on what I'm assaulting. So don't hesitate to tell your friend to shut up if they're being loud and obnoxious. Yes.
I can help every time I take a manual blood pressure on my residents. Like, it's so hard to listen for, on and off beats.
Sure.
And they're like talking, you can hear everything.
Yeah. Yeah, you guys will learn too, just when you go in to do a TPR, the client's gonna be talking to you the whole freaking time, you're trying to get a heart rate. Sometimes I just blur out everything they're saying to me. And sometimes I'll say, just one sec, let me count this real quick and then say whatever you're gonna say. But yeah, sometimes it's tricky, especially when you're learning, it can be frustrating. Okay, cardiac output, it's important. I don't need you to know any of this, so you can just I don't know. It's important, but again, it's a little bit more than we need to go into. This kind of takes into account what they call the stroke volume, which is how much blood comes out with every contraction of a chamber. This is way farther, again, harder core than we need to go to. But you can actually calculate, let's say we have a concern with a pet. We don't know if her animal is producing enough blood to circulate across the whole body, or if her heart is able to pump all of that blood all across the whole body. So what we can do is an echocardiogram, where we can actually measure the amount of blood in one chamber through contraction, times that by the heart rate of a dog, the patient, and we get what's called the cardiac output. At that point, we look at a table that references normal cardiac output and determine, is your dog producing, or is his heart rather, able to produce enough circulation to circulate every internal organ to make sure that he doesn't become exercise intolerant. So in terms of the disease process, yes, this is important. You don't need to know it going in though, okay? There are ways, again, with heart patients that we can do a little bit more diagnostics to determine quality of life, outcomes, prognosis, all of that kind of stuff. Okay, so stroke volume, again, we have a couple of terms related to it, preload and afterload. Can kind of make sense of this. So preload is the volume of blood that the atrium receives. The afterload is the physical resistance by the artery that the ventricle is ejecting blood into. So we have two. We have the aorta and the pulmonary artery that we could measure. And again, determine, is the dog not able to produce enough to get into the lungs? Or is the dog not able to produce enough for the blood to even get back to the heart? Because that's two different problems. Okay, if he can't oxygenate himself, that's a go to Jesus moment. Okay, if he's not pumping enough blood to circulate his whole body, we have drugs for that. Okay. So heart rate. Heart rate's determined internally. Again, it can have innervation from autonomic nervous systems. The SA node is responsible for setting off that chain of events, or what we call depolarization. All right, so we have two main vessels, our arteries, and our veins. You can kind of appreciate some of the differences here and in your textbook between the artery that has a really thick muscle compared to the vein has really small muscle. You can also notice that the vein has these pesky little freaking things that are valves. Why do you think there are valves in our veins? So it only goes one direction, back towards the heart. Exactly. Because what would happen if we didn't have valves here is our bad blood could back up into our body instead of being sent to the heart to get fresh again. What sucks though for you guys is when you're trying to draw blood or you're trying to place an intravenous catheter, that you touch these stupid freaking valves and you can't get through it. There's nothing to do but pull out and start over. Stupid little valves. You just don't know where they are either. Never know where they're gonna be. All right, so again, the arteries, very thick muscle in comparison to the veins, and the veins have valves, little stinkers. All right, so we've talked about a little bit of this, but this is a great little note sheet for you guys as far as our arteries go. So again, arteries away from the heart. We have our deoxygenated blood, again, going to the lungs to get fresh. And then we have the fresh blood going throughout the whole body, right? So arteries are very important in carrying out this whole process. Usually arteries come in pairs across the body. We have two different types. We have our elastic and our muscular. Our aorta is the largest elastic artery. Truly, he's the largest artery. Okay, and then our muscular arterioles, or arteries and arterioles, are just that. They're more muscular. Now, it's nice to have the muscular. Why? This is the same in veins, just a lot bigger in arteries, just like we saw in the picture. So what does that smooth muscle layer do for us? Okay, it does help push it, sure, but what else? So what do the muscles do for us in the veins or arteries? I'll take either. Okay, yeah, a little bit for sure. Yeah, definitely, a little bit. Structure, okay, maybe, sure. But it has a job. It has a job. So you remember vasoconstriction and vasodilation? Same thing happens here. The only way we can control how big a tube gets or how small a tube gets is the muscle. Okay, that smooth muscle, either expanding or contracting, making it bigger or constricting it. Okay? So arteries away, fresh blood. All right, and then again with our capillaries. So very, very small, extremely important. Right? If it was not for the capillaries, we would have no way to trade out the bad CO2 blood for the fresh O2 blood. Okay, so again, it's our capillaries. Very, very, very important. Again, 1 cell thick. Usually they do lie in what we call capillary beds or capillary networks. It's not just 1 cell hanging out by themselves. Remember the picture going back to like the liver and all the organs, and it had the red coming in fresh and the blue coming in gross? That little like net in between was the capillary beds. So where does gas exchange take place? Capillaries, very good. All right, and then our veins. So the veins are taking bad blood back to the heart. Veins travel back to the heart. Capillaries are the guys that sit in the middle, right? So we have, let me see if I can draw it out for you guys. We have our capillaries kind of sitting in the middle, and then we have our veins and our arteries. Do you remember what did we call our small arteries? Arterioles. And then here we have our venules, okay? So this is kind of how it works in terms of how do we go from one giant tube of an artery down to something that's 1 cell thick. we go through smaller and smaller branches until we get to the capillaries. And then coming back, we come through venules to get into our veins. Again, we have one-way valves that keep all the blood moving towards the heart at all times. All of your veins in your entire body drain into your vena cava. Again, the vena cava is the big tube that brings all the bad blood back into the right atrium. Okay? Veins. Veins are important. So which blood vessel in the body carries oxygenated blood like an artery, but carries it towards the heart like a vein? It is. So let me go back. Earlier, I was a little worried to throw this out to you because it's a freaking trick. And I'm sorry. Find a good picture. That one's just friggin' backwards. I'll go all the way back up. Or we'll just use that copy one. Okay, so we'll just use this one. Yeah, this is right. Okay, so we have our right atrium. What is this valve? Tricuspid. Then we have our right ventricle. And then we need to go to the lungs. Because I am traveling away from the heart, this is called a pulmonary artery. Because I'm traveling away from the heart. But what kind of blood has he got in him right now? Deoxygenated, right? So it's kind of a trick with our rules, right? That we say arteries only have fresh and they always carry away. This is a trick. I'm sorry, I don't know who's responsible for it. But this is our pulmonary artery. It is leaving the heart to go to the lungs, but he has bad blood in him. Okay, and then same thing, when he gets all fresh and happy, he's gonna be fresh blood in a vein coming back to the heart. Okay, so Haley just answered our pulmonary vein is our kind of a tricky guy, but in addition to, geez Louise, I'm all over the place. In addition to the artery, they're both kind of a trick. Okay, so which blood vessel in the body carries oxygenated blood like an artery, but carries it towards the heart like a vein? And so again, it's just kind of going off of our standard rules that we have built so far. Arteries always go away, and usually, almost always, 99% of the time, are carrying fresh blood, except for in the case where we're heading to the lungs from the heart. That's bad blood traveling away from the heart in an artery. That wasn't too tricky, was it? Just the stupid rules that we can't follow, right? All right. So this kind of shows a nice little breakdown. I like this one here. So our heart, arteries, arterioles, capillaries, and then back again, venules, veins to the heart. Okay, so I kind of already wrote that out for you guys a little bit. So again, the aorta has our oxygenated blood, but our pulmonary artery is deoxygenated. But again, it's because he's traveling away from the heart that we call him an artery. Okay, and then on this side, your vena cava is the big one. Okay, again, that's bad blood. And then the pulmonary vein coming back to the heart has the fresh blood. I'm sorry they trick you. Okay, how do you guys feel about that? Yeah, I'll take it. All right, things get a little bit weird in the baby. Real weird in the baby. So obviously the baby's, or the fetus is getting the blood from the mom, right? So lungs are not into play in a baby while they're still in their mama's belly, right? Lungs don't really do anything at this point. So oxygen is getting transferred through the umbilical vein. When the baby is born and they take their first breath, the lungs inflate and they can start their own respiratory exchange at that point. We have a couple holes in the heart, in fetus hearts, that again, when they take their first breath and their lungs kick into action, these holes in the heart start to close up. Sometimes they don't. Sometimes they don't, and then we have big issues. Okay, how old is your king? 9.5. Can I use her as an example super quick? Okay, so you guys maybe know Haley's little pup. Oh gosh, she's 9.5, God bless her. Has the heart condition, she's got a murmur, she's got all sorts of things going on, but she's 9.5. It kind of makes sense, right? Plus we know her breed, so it kind of makes sense. What if you had a 3-month-old puppy come in for his distemper shot and he has a murmur that you can feel out here? What the hell? Hole in the heart didn't close. Blood is flushing or flowing through a hole in the heart, and you can hear it or feel it like a murmur. But at 3 months, should we have whacked out valves or whacked out chordae tendineae? No, but in a 9.5-year-old, we can expect that. So when and if you ever have a puppy, it's not very common with cats, but it can happen. If you ever have a puppy who's young, a very young pup who has a murmur, it's usually something to do generally with the ductus arteriosus. We call it a PDA or a patent ductus arteriosus. That is a $3,000 surgery that only K-State can perform. And it's not a 100% guarantee that the animal will wake up. It is common. I've seen probably 6 or 7 of those. 1 or 2 went to treatment. Like surgical treatment is the only option for it. If it doesn't close by 2 months, you've got issues. So what they're showing us here are some of the holes. So our oval foramen. So again, hole in the heart. And then this one becomes closed. And then we have also somewhere up here, the ductus arteriosus is open. And this is just helping to, again, transfer blood through the umbilical vein. This closes also. You can see this. Again, if that stays open, once they've been born, we can generally hear it or feel it and need to close that. And I'm not going to ask you anything about umbilical circulation, but just so that you know. Real quick, guys, let me see if I can pull something up here without jacking up the system too much. Where do I click? Okay, that's right. This PC. This isn't like my desk computer. I'm trying to just type. Aha, there it is. Okay, thank you, Jesus. Because I had somebody last semester send me a really neat picture. Let me see. I'm not seeing it. There it is. Okay. Lizzie, would you mind? Thanks, love. Okay, let's just look at some pictures. Okay, this one probably do it for me. Okay, so this is a nice heart. Again, I am looking at this x-ray and I'm shaking his right hand. Okay, so this is right side, this is left side. See how the tip points to the left, like we said, the lecture? That's normal, okay? You should have a slight tilt a little bit. So what you're looking at, the black triangles on each side are the lungs, very good. And this is our heart. Now, it's hard to kind of look at and say, oh, this is this and this is this. But you know, again, the atria sit very high, very cranial, right? And that down here, the apex is going to be your ventricles, okay? So you can make out quite a bit. What's this structure right here? The diaphragm, very good. And then we'll learn all of our abdominal organs as we go through next week. So right off the bat, you can see this picture.
It's a very loving dog.
Yeah, so this is actually something that is pretty common to see. So let me show you here. This was a student that we had, because I don't know where that one on Google came from. But I mean, it's pretty obvious to see. This one, very similar, okay? This was a pit bull, 6 years old, I believe. She started not being able to go on walks with her mom, and so her mom took her to the vet, and they determined that she had, this is called hypertrophic cardiomyopathy, or dilated cardiomyopathy, where the heart has grown to the size of West Texas. And again, Haley and I kind of talked about this a little bit, and that isn't it amazing that the body gets the message that shit's going downtown and tries to fix it? Because what happens is the heart says, oh crap, you guys, there's no way I'm doing my job. I'm not oxygenating near as much as I need to. I need to get bigger and stronger. And that's what happens is the muscle of the heart, the muscle grows so thick, thinking that a thicker ventricle is going to be stronger, but it actually makes it harder to pump as efficiently as someone who is maybe sleek and slender, right? So the body's thinking it's doing the right job by getting huge of a heart like this, but it's actually part of the process of disease. So with Shadow, I believe was her name, Storm's huge heart. Storm was euthanized after some treatment that she was not really responsive to. Pit bulls do have some heart problems. I don't know that I put them as high up as boxers, but they definitely do. This is a great x-ray also because of this structure. What is that? That is my glenoid cavity of my scapula. This is the head of the humerus.
So how does it work for like mixes? Like if they're mixed with something else?
Generally, mixes are healthier altogether because of what's called hybrid vigor. So mutts are generally not as predisposed to as big of issues. Can they get dilated cardiomyopathy? Yeah, sure. Are they as likely to as the standard full breed dog? No. And that's across a lot of disease processes. Yeah, I'm so freaking excited for intro tomorrow, you guys. Oh my god. Not because of the sadness and all that, but because I do have a little bit, and we haven't got to talk about this yet, so I do have a little bit of a spiel. Storm and her whole workup, our student shared with us, her very first visit was around $1,200. As a college student, how many of you guys have $1,200 in your bank right now? Not even me, right? Okay, so that's kind of where we'll go with intro tomorrow as far as some of the decisions that sometimes we have to make in our world. But yeah, this is a definite real case, a couple years old, of a pit bull with a huge, huge heart.
So there's nothing really to fix that.
So you try to give drugs to reduce the workload of the heart, to try to make it easier for the heart to work. So inotropic drugs generally. And then oftentimes, again, because the heart is so huge like this, it's not pumping as good as it should be, and fluid builds up. Again, a lot of times in the sacra on the heart. So they're often on a diuretic as well to reduce any excess fluid that's not blood.
So you just push pills, basically.
Yes.
Could it like not oxygenate the blood because the lungs are so small?
Well, that could definitely lead to it for sure. In a case like this, where again, you have no lung field. You have such little lung field. Is there still some oxygenation taking place? Yeah, of course. Is it as rapid or as quick? You're right, maybe not, probably not, because all of that space is compromised. I will say though, guys, just because you don't see one right here, where is the lung? It's been pushed up dorsally, right? Because the heart, again, in an animal, is laying quite ventral, right, against the sternum, right? So there's, a little bit of space, so it's not likely, that he's lost all his lung, but that's a great point, Merce, for sure. We'll come back to some x-rays, like this one looks like a good one, for next week when we start our GI and digestive stuff. But yeah, that's pretty much it. Okay, one more and then I'll have you hit the lights, Liz. While we're here, I might as well show you. This one's okay. I wish I could blow it up bigger. Oh geez, okay, stop doing that. So just because we had bones already, right? So again, you can see the beautiful glenoid right there again, the scapula, the spine of the scapula, and then the humerus. You can see your nice olecranon process of the ulna, right? So just again, to show you what you kind of have learned. Now, when you get to x-ray class, you'll be looking at a whole bunch of x-rays and determining, is that a good x-ray or a bad x-ray? This is a shitty one. And the reason why is because I can see 2 of his scapulas. In a perfectly positioned x-ray, I should only see 1. He moved or somebody wasn't doing their job right. Also, I can tell, I see both processes, or both sets of ribs rather. Again, in a perfectly positioned, I should only really see 1.
So like he's not really lateral.
He's not perfectly lateral, no.
It is pretty clear.
I mean, it's not bad. It could have a little bit better contrast, if I was being honest. Okay, cool. Lizzie, thank you so much. All right, so pulses. Okay, so this is something you guys are going to go home and you're going to listen on the left side of your dogs or cats or guinea pigs or rabbits or whatever animal you have. I want everybody to do that, okay? Okay. The other thing you should do is try to feel your animal's pulses. Have any of you tried to do that before? Yeah? Okay. Yeah, yeah. So my favorite is the femoral artery, so going in the inguinal area, and your puppers will be bounding, I bet. Yours, I did feel her pulses when she was in Masu, and she had some pretty nice ones too. So you go all the way up the inner medial part of the femur, all the way to the inguinal, you know, if I was like this, right? And feel against the inner thigh. And you should feel a pretty decent size vessel, which is the femoral artery. And this is often where we teach you how to palpate a pulse while you're sculpting. And the reason is that we want to make sure that the pulse and what you hear on the stethoscope is exactly the same. If they're off, something is wrong, okay? So I want you guys to maybe try to feel up some pulses at home. You can do this on cats. Sometimes they don't hold still as well. And sometimes the amount of fur up in here, like Milkman, I can never feel his pulses because he has so much fur. Okay, so pulse. Pulse is very important. Okay, pulse kind of tells us how hard the heart is working to oxygenate all over my body, okay? Whereas the listening to the heart beats is only telling me about what? The valves, exactly. Okay, so getting an auscultation and a pulse together give you a better picture of the body's complete cardiovascular system. So what it tells us, the rate of alternating stretching and recoiling of the fibers in the arteries as blood passes through with each heartbeat. So this is, again, kind of a way to feel the amount or the force that the heart is working at. Because I can't really feel that when I get a heartbeat. All I'm hearing are the valves, okay? So that's where the pulse is really important. So generally, you will feel an artery and say if it's strong, if it's weak, if it's bounding, if it's thready, if you can barely feel it, if you can feel it from an inch offside the animal's leg, right? There's some, seriously, you can't. Again, listening doesn't tell you much about the force that the heart's producing. It just tells you about the doors. Where the pulse gives you the clue about the force. How hard is the heart actually working? So we have a way in anesthesia monitoring that we teach. If you can feel the pulse at the medial metatarsal artery, maybe it's dorsal metatarsal, it's dorsal because it's that. If you can feel it all the way in the bottom of the dog's leg, you know that the blood pressure is at least 80, which isn't great, but it's okay. So if you can feel it clear, like this would be almost close to what we would be feeling in a dog's paw, okay? If the beat is making it all the way down there, my blood pressure is at least 80. If you can only feel, and this is again anesthesia monitoring, guys, this isn't like generally everyday life. If you can feel a femoral pulse, you know that it's at least 60. Okay, so it gives us just a quick kind of view in terms of how hard, in terms of pressure, that the body is working. So the farther away from the heart you can feel it, there's a decent amount of pressure going, right? Okay, so pulse is very, very important. I will say just altogether, the power of palpation and your sense of tactility is very important. You guys, you know, there will be someone, I'm sure, though I said this about blood smears, and you guys kill blood smears. There will be somebody who gets mad that they can't feel a pulse. Well, how many times have you tried to feel something with your finger that's tiny? You'll get better the more you practice. But it is a very important thing to practice your sense of tactility, so what you can feel in your fingertips. Okay, so doing this at home, doing this on your mom's pets, is all good practice.
I have horses if people want to try.
Well, and horse is kind of a cheat.
But I mean, if they're not good at a dog.
No, you're not wrong. You're not wrong. And yeah,
you
you
can
guys will
feel it in
definitely.
their foot too.
Yep. And I don't know the numbers for horses, but I bet it's similar in terms of monitoring, that if you can feel it down by their hoof, their
Probably.
pressure's
Because you can feel
pretty
them
decent.
set their foot up on the bottom.
Mhm.
We should be able to.
So in normal animals, or rather healthy animals, the pulse is the same as the heartbeat. So when you're listening and you're feeling, it's all bump, 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 bump together. That's good. That's great. Again, in some animals with the disease process, you might hear something bump and then feel it 2 seconds later. Is that normal? No, something is whack.
What does that indicate?
Usually stroke volume issues, not pumping enough, and or having a delay because of valves. Like the blood is squirting out 2 seconds later than it should have when the door shut.
So on a murmur, would you feel it different than what you're hearing?
Not always. No, not always. The only times, guys, that I've had pulse deficits, which is what it's called when the heart doesn't match the pulse, is in patients in stroke. They're stroking out. So, yeah, that's a term too, guys. What you think of as stroke isn't really right. We'll get to that in emergencies, and we'll talk on that. The larger the animal, the slower the heart rate and the slower the pulse. You guys haven't learned that yet, you will. The smaller the animal, the faster the heart rate and the pulse. So Chewy is a Chorky. She has a really fast heart rate because she's 8 pounds. If we had a Great Dane, his heart rate is like 60. Okay, what were you gonna say?
Do you have a way of like, if you indicated that like this was an alternating pulse? Like we would call it like an apical pulse is what you listen to in a heart, and then a different like radial or something.
Yeah, no, not quite. What I would say is if you go back to our medical record form at the very top where it says HR, that's your heart rate, that's generally what you're sculpting. And then down in the sections that you widen, there's a part for cardiovascular, and that's where I write pulses. So I'll say femoral pulse matched heart rate, yeah, something like that. Or femoral pulse is bounding, or couldn't feel them, or something like that. So yes and no, just a little different. But I would say if you're doing something procedurally for anesthetic monitoring, yes, do. Because the idea with that is if he comes back in for another procedure, you know exactly what you did and a way to trend it. So yeah, again, different arteries and different species. So in the horse, you can do their face or their foot artery is what we'll call it for now. And it generally is best over a medium size. So that's why I like the femoral best. The dorsal metatarsal can be a little bit harder to find because it is a little bit smaller. But if, again, you work on your tactility, you'll be able to find some really small vessels. Yeah?
So the reason that large animals have slower pulses takes longer to go through the body?
Yeah. Genius is up in here, you guys. Yeah. Yep, indeed. And like with a horse, like 40 beats per minute. Again, Chorky, 100, right? And that's across all species. What is an elephant's heart rate? 8?
8?
I don't even know.
Gonna guess
Mice
10.
can get up in the 400s.
You can't even clock that. Birds the same way. You can't even count that. You just say they're alive. They're alive. They have a heartbeat. Because yeah, it does. Rabbits too can be hard to clock actually sometimes.
Hummingbirds actually go into a torpor at night,
Hmm.
so it like drops almost a nil.
Interesting.
'Cause
Interesting.
They can't. They don't have enough nutrients to maintain their body rating
Yeah.
24/7.
Right.
They literally will starve themselves out
Yeah.
and sleep during the night, so they go into a voluntary torpor every night.
That makes sense. That makes sense. That is cool. So get the heart rate then. Mercy, what were you gonna add?
They answer.
Oh, they did? What was it? Share.
I was just asking about like humans, how like different people have different pulses, and she said like the younger you are, the faster. Unless you're really in shape.
Yeah.
Long distance
Yeah.
runners have stupid low pulses.
Were you wanting the pulse or the heart rate of an elephant?
Either or. Give me
The
either.
heart rate of an adult elephant is often quoted as about 30 beats per minute.
Okay. So about a horse.
When they lay down, their heart rate speeds up 8 to 10 beats.
Oh, interesting.
So I'm like,
That's like a horse too. 'Cause it's hard for them to lay down.
Yeah.
All their organs are being compacted.
Very cool, you guys. Good info. Good info indeed. All right, and then our blood pressure. So again, we don't do blood pressures until emergency. Emergency class is like hardcore. You're doing all of this stuff.
Hard for them.
But what is it measuring? Again, the amount of pressure that the blood is exerting on the artery itself. So it is dependent on a couple different things. So the amount of blood total, because if you are dehydrated, your blood pressure can be affected seriously. How elastic are your arteries? This has a lot to do with, in human medicine anyway, how much cholesterol buildup you have, how much can they actually move if there's a lot of plaque buildup. What is the stroke volume? Again, how much is actually coming out of the heart, and then the heart rate itself. So blood pressure is pretty important. Again, it's telling us kind of the pressure. But for me, what I kind of think of with blood pressure is that it's making sure that all of my tissues are oxygenated perfectly. Without that, without decent blood pressure, my organs are going to start to fail because they're not getting oxygenated appropriately. Yeah.
The stroke volume, does it have anything to do with how it clots?
No, I wouldn't say that. I would probably put that more in the category of blood volume, though I know it's not necessarily dependent on how much blood. But when you talk about being dehydrated, your blood does get thicker. Now, again, that doesn't have anything to do with the platelets or thrombocytes or clotting, but it does make it more difficult to flow because it's sludgier. I don't know, did that help?
I just, when I hear stroke, I think of like when you get a blood clot and that causes.
Yeah, so again,
So that's what
no,
it's like.
don't think of that as stroke because, yes, that is at Grace.
If you think of like they play golf and a stroke. it's
Yeah,
like-
an
it's like
action.
the strength of the
Yep,
beat.
yep. So no, but I can see where you're going. I can see where you're going with that. So again, we have our buddy systolic and diastolic. So systolic blood pressure, that's generally the high number when a human person does your BP and they're like your 120 over 80. 120 is your systolic, 80 is your diastolic. And again, it's referencing contraction and relaxation. We really only generally care about the systolic. Okay, yes, there are clinics out there that will use the diastolic, not many that I've ever worked at. But again, with anesthesia monitoring, some of the monitoring that we do for anesthetic procedures is a lot more in depth than we do for an exam or for a basic treatment or hospitalization. So on some anesthetic monitors, you will record systolic over diastolic. But what's more important to us, clinically speaking, is the mean. Okay, so we're getting our MAP or our mean arterial pressure, and that is an average of the systo or systolic and diastolic. So generally, that one's more important in addition to the systolic. If you guys don't know yet, this is worth writing in your notes, because the reason that I keep bringing anesthesia up when we talk about blood pressure is gas anesthesia causes two things to go shitty in your body. Every single patient, every single time. One of them is a reduction in blood pressure, okay? So that's why we're talking about it. And the other is reduction in body temperature. okay? It is a fact that when you put a pet under anesthesia, he will experience a reduced blood pressure. Okay, so there are some things that we do to fight that, either with drugs or fluid therapy, to make sure that he maintains his blood pressure throughout his dental. Okay, because what happens, we put a pet under anesthesia. We already know it's gonna affect his blood pressure. Blood pressure is why so important to my body? Perfusion, AKA oxygenating all of my tissues. Okay, there are cases, guys, where blood pressures get so low, the pets won't wake up. Or they wake up and they're brain dead. Or they wake up and they're in kidney failure. I could keep going all day, honestly. It was a stupid dental. It was a cat neuter. No, because you take, again, appropriate steps with your pre-medication drugs and forcing clients to use IV fluids. IV fluids will directly stop most problems with low blood pressure in anesthesia. So again, why I keep bringing up anesthesia when it's so far out for you guys, it's really, really important when we talk about blood pressure to monitor that kind of thing. 9-year-old cat yesterday, mean ass cat, at minimum, I said we have to have a blood pressure going. He's 9. He's gonna be drugged on a really crappy drug that causes bradycardia. So I've already reduced his heart rate on purpose with the drug that I chose. I know for a fact his blood pressure is gonna be messed with. Okay, so he actually had some pretty decent blood pressure all the way through, even though a normal cat heart rate is anywhere from 160 to 200, his heart rate was 60 because of the drugs that we used. Okay, and again, knowing that that is gonna be what I see. Okay, I had students yesterday freaking out, oh my God, his heart rate's only 60, knowing that that's not normal for a cat. I said, remember, what drug did you use? What are its biggest side effects? Okay? All right, I think we covered blood pressure. All right, so we have a couple different ways we can measure blood pressure. We have the oscillometric and our Doppler method. Pretty much on a computer, digital, old school radio box from ET. So the Doppler is the one that we are using where we actually hear the heartbeat. This is my preference every day of the week. Okay, this is, you guys will run both, but the one that we will use on most procedures is the Doppler. And that's again because I can hear the heartbeat through a little radio box. There's no greater feeling in surgery than that. Are you still going to be checking the heart rate in the squelching? Sure, but I can hear it. The oscillometric, again, is generally like little nurse person comes in and takes your blood pressure on a little cart thing. She wheels up to you and slaps the thing on and pushes the button. That's oscillometric. We do use these. We might even have a surgical patient hooked up to both. Okay? Doppler is the best. Doppler is the best. Oscillometric can measure systolic, diastolic, and MAP. Doppler, you're only getting systolic. That's the only one I really give a crap about, though. Let's just make one last little note. 80. If you're taking blood pressure notes, just write 80 somewhere up in there. 80 is the magic number. 80 is the magic number. If my blood pressure, well, not mine, but if I were a dog, if my blood pressure as a dog were to dip below 80, my organs are at risk of failing due to a lack of oxygen. Okay, so 80 is kind of a magic number. That's for anesthesia, that's for real life, that's for just, they have to at least have an 80. Okay? All right. You'll get so much more blood pressure later. All right, guys, we are doing really, really good here. Let me just do a couple little slides and we'll end it early here. So some testing to check out the cardiovascular system. Again, listen, listen, right? Again, it's only gonna tell you so much, but it can give you a clue to the health of the inside chambers of the heart. right? Yeah, Taylor, what were you gonna say?
Is the 80 for the systolic or the diastolic?
Systolic. Good question. Okay, so some other things, palpate, feel your pulses, right? You can do an arterial blood pressure evaluation as well. Take some chest rads, look at the heart on x-ray, measure the vertebral score, like they did with Haley's pet. You can do an electrocardiogram or the EKG. Again, that's going to just tell you electrical conduction in reference to chambers of the heart, but as part of building a picture of the disease, it's helpful. It's helpful. And then we have our echocardiogram or cardiograph. So this is using an ultrasound to look at the heart and actually watch the blood flow in real time with the ultrasound. Often we just call that an echo, and everybody knows an echo is for the heart. Okay, so our EKG, again, this kind of correlates the electrical conduction of the chambers of the heart to a pattern on paper. You guys will learn next semester how to count these little boxes. 1 box, 2 box, 3 box, 4 box, 5 box, and actually get a heart rate by looking at a strip like this, because you can. Do you generally in real life? No, but you have to learn how. And then again, kind of going off of which part of the pattern means what. So just real quick, as an intro, your P wave starts you out, QRS complex is the big tall wave, and then you usually have a T wave. I don't know why he's upside down. He's stupid. I would have actually probably even called him a T at the top. I know, he's a crapper one. And then the echo. So again, using the ultrasound. And it's actually really cool, you guys, if you ever get a chance to see one performed, they are really neat. So again, ultrasound uses the sound waves that bounce off tissue and fluids and whatnot. This is where a lot of times we get our stroke volume. So we're actually looking at blood flow. This is an ultrasound, and you can measure, again, in real time, as the heart is pumping, how much blood is squirting out with each beat. So it is really neat to see. So this color, again, gives you a reference of quantity. Oftentimes, it's a cardiologist, somebody who's specialized in internal medicine who's doing this kind of thing. But it is pretty cool. If you have a dog who has heart problems, like let's go back to that big heart, volleyball in the chest heart. Can you put that dog on his back? Not only no, but okay, very good. So one of the doctors that I worked with at Babs, who was a cardiologist, he had a whole little room set up, a $14,000 ultrasound machine just for his echo patients. But he had the coolest thing. He had a table with holes kind of cut out in different spots so that he could lay the dog on the table, take his ultrasound probe up and under. So you're not stressing that patient out at all, because if you even try to lay him on his side, we're going to have problems, right? So he would just have the dog lay, and he would kind of get to where he needed from up underneath the table. And I said, whoever built that thing is a genius, hopefully making millions, because that's the hard part about these kind of cases. Just to even take them onto the x-ray table and flip them on their back for an x-ray. That's asking for potential problems, right? That's going to be stressing them out when they already feel like they're dying, right? So I thought that was the coolest thing. And that's the only one I've ever seen. Even up at K-State, they don't have quite the same setup. All right, you know what, let's save this. Why don't you guys go ahead and go. You have been rock stars today. I know that was a lot to get through. Review your notes, but maybe get ahead for respiratory, okay? Tomorrow we're gonna recap, finish, review the heart, maybe start in on resp, okay? All right, guys, have a good one.